I'm James Milan, and this is Talk of the Town. Welcome. Today, we are going to be talking about a subject that is very serious here in Massachusetts and nationwide, very familiar, I think, to all of our audience as well, and that is substance use disorder. Its current manifestations and what can be done about it, including myths about addiction, etc. And to do that with me, I have, he doesn't see himself as an expert, but I do. Will LaCouture is joining me. Hi, Will.
James, nice to see you.
Thanks for being here. Will is the Director of Community Outreach for Brightview, Massachusetts, and Brightview runs in a number of states outpatient addiction treatment centers, and so Will spends his professional life in this space, and we want to tap into his knowledge and talk extensively and in some depth about what the current situation is. So again, I thank you for being here.
Well, thank you for having me.
Can you start us off by just actually at the most basic level, why not start there? I think most of our audience is already going to be able to supply an answer of their own to this, but what is addiction?
It's a disease, and it's something that people can't control. It's like having heart disease. You don't choose to have heart disease. You don't choose to be an addict, and it's something that can be treated with medication.
Mm-hmm. And I actually want to start, before we start talking about the services that Brightview and other such companies provide, and also what the general issues are here in Massachusetts, I'd actually would like to start with the things that people think that aren't accurate and that aren't true about addiction and treatment for addiction, etc. So what are some myths that you're probably very familiar with that you can share with us?
It's a great question, James. You know, some of the factors in the society is people can cut cold turkey on it, and that's not the case. If people don't get the proper treatment on it, it can be deadly. And you know, people that have addiction, we need to treat these people that have addiction like they have a normal another disease, heart disease, diabetes. You treat them with passion and empathy, and you give them the resources to help, because if they're not getting those type of resources, they may not want to go to treatment, and they may start using more drugs because they're feeling ostracized, they're feeling excluded from society. If we educate society on helping people in the community and the resources that are available to people that need to get addiction recovery, that's the big thing right there, is just helping them.
Mm-hmm. Yeah, I mean, I think what you're speaking to there is like this stigma, which we're all very familiar with, right? Which makes us think collectively about such people who are in need of treatment for substance use disorder. We may think of them as, oh, they got themselves into that situation, they should get themselves out, or oh, that poor person, too bad for him or her. Again, not really seeing people in those situations with compassion and the sense that, oh, you know, there but for the grace of God, blah, blah, blah. But instead, it's really, we are excluding them in a sense as a society. It's part of what I think you are both combating against and trying to educate around.
Yeah, if we educate the community, you know, like we're working with a lot of local police departments and providing resources to them as far as some of our partners, so that we're able to help people get help at our centers and also our competitors, because as you and I were talking earlier, this is an area where we're not competing against each other, we're here to help people. And we want to utilize, if we can't help someone here, we want to get them help right away, because a day could go by and they're not getting help, that could be deadly. And we can't just put someone on a waiting list for 3 weeks. We need to help them right away. And that's where Brightview offers patients to come in, walk in during the week. And that's something that we take great pride in trying to find and help them and find the resources right then and there. And we customize, and a lot of other people do too, as far as outpatient services, is we try to customize what we're doing for the patient to help them as far as what's going on in their life.
Right, because every patient, as we know, is different. And I do want to just kind of follow up on something you were just saying. And again, kind of delineate the many ways in which the work that you're doing and the space in which you're doing it is just fundamentally different from what we think about as, businesses competing against
Correct.
each other, right? This is not somebody walking into your car dealership and you want to make sure they buy that car from you and not from the guy down the street.
Right.
Because you've just said it yourself. This problem is too big. It's a societal problem. You are now putting yourselves on the front lines of something that we all have an interest in, but you guys can and are actually doing something about. So in order for that to happen, you need to, I assume, work in conjunction with other people providing, or other businesses providing similar services, and also with other kind of I was almost tempted to start saying kind of social welfare services, which a police department, most people don't see a police department as, but here in Arlington, we have a recent history going back at least 10 years, if not more, of a police really seeing themselves as tackling this problem, especially the problem of opioid addiction, in a way that does not stigmatize, that does not try and criminalize behavior that, as you said, is more around health and around disease and around treatment of disease, and not, again, incarceration or some other form of isolating those people who are suffering. Instead, seeing themselves as being among the providers of recovery services, in a sense. Do you guys work actually with the Arlington Police Department?
Yes, we have. We work in, we just actually had some representatives over to our center over on Mass Ave a week or so ago, actually last week on the 15th. And we've met with the chief of police as well too, and they're awesome to work with. They really want to help within the community, and also set an example here in Massachusetts as far as some of the things that they're doing as far as addiction and recovery towards getting for the addiction. And we provide services back to them as well too. We're not just here to help their patients get outpatient services for recovery for their addiction, but we also want to help them as far as transportation to the facility, whether they need a job, food, some of the essentials for everyday life. And we have a resource, a referral network that we utilize a lot of services that we want to actually expand and give to our partners that we work with as well, whether it's the police department or if it's a hospital, it could be the parole officer. We're trying to make people's lives better, and one step is starting with treating the addiction.
Mm-hmm. And again, you see yourselves as part of a network of different services to, again, address this issue, which has so many different facets to it, not simply the physical addiction component that you guys really deal with, very directly. Let's take a step back for a sec, if you don't mind, and talk about like what the overall situation is like at the moment here in Massachusetts, which I assume you, as the director for community outreach for the state in general, you're probably aware of like what are the things that are most troubling, most concerning for us as a population in this space of just substance abuse, let's say. What are the drugs that are most worrisome at the moment? What are the kinds of things that, what are we seeing here?
Great question. There's obviously the opioids is a major problem, and there's also the fentanyl. And then it's also the tranq that is actually now found in the fentanyl as far as a horse tranquilizer. And that's a major concern because the Narcan can't help on that. And it's really alarming in many ways. Obviously there's alcohol, there's cocaine, there's all these other drugs that are out there that is major problems here in Massachusetts and throughout the country. But at the same point, there's other drugs as well too that can cause addiction, sleeping pills, depression, attention deficit type of medication. Mm-hmm. These are what we're seeing out there, and the issue is not going away anytime soon. We're here just to try to help people recover and live a better life and deal with a lot of the issues that they're dealing with as far as their addiction. And it's concerning, and it's growing, and I know the government and the state has done an awful lot as far as putting resources back into helping people. We work a lot with a lot of hospitals. The state of Massachusetts has set up these community behavioral health centers that we're working with to help patients, instead of going to the emergency room for addiction and overdoses, they're trying to push them towards the community behavioral health centers, and we're working with a lot of these centers to help people get off their addiction.
Mm-hmm. You know, you were, in what you were just saying, you mentioned tranq, and this is horse tranquilizer, I guess, that must be being cut into, fentanyl, which itself is also cut into other substances. And then you mentioned that a big problem with that is that it is resistant, or Narcan is not effective. Correct. In that situation. Let's just remind folks what Narcan is.
Well, if someone overdoses on an opioid, Narcan is administered and it helps save their life. That's the big thing. We're trying to teach more and more people how to be able to administer the Narcan, and at the same point have them available. Police departments need to have these. Hospitals have them as well too. So it saves a lot of people's lives when they're overdosed. You know,
as I was preparing for this interview and doing some reading to do so, I was surprised, because I don't see it on display or something like that, to hear that Narcan is available in most pharmacies and at CVS, et cetera. Did you know that?
No, I didn't.
Yeah, I assume that is true. I have not yet done the personal investigation of walking into our local Walgreens or whatever. But if that's the case, then I assume that one of the things that you guys are trying to make sure that people understand and educate and encourage people to do is carry Narcan with them. Right. Again, just because they may know somebody who might need it, or they may not know somebody who turns out to need it, right. And they happen to be in the area. I assume Narcan does work that well, right? It
does, yes.
Yeah, and it's the only game in town, I think, in that way. Is that right?
Right, but it doesn't help on the tranquilizer.
Right,
and that's the concern.
Yeah, that sounds it. Yeah, that's a big concern.
Right.
So one of the things I was wondering is, you were mentioning before, and we should make it clear. I made the analogy to a car dealership and to the fact that this is a societal problem, and that's a very big difference. But the other thing that we should talk about, and you did allude to the fact that Brightview allows for walk-ins, is the fact that when somebody needs your services, when somebody is in crisis in this particular way, they need help right then.
Correct.
Right? We can't afford as a society or a community for them to have to wait for a week, 2 weeks, 3 weeks, which is so often the case. So how does it work when somebody walks in your door? Just kind of walk us through what happens at that point.
Great question. If a person walks in before 3 o'clock, 5 days a week, Monday through Friday, they will go through an intake process. They'll go through some clinical and medical, and then they'll be seen by a provider. There's some paperwork that has to be done. And then the next day, they do some follow-up as far as setting up appointments, other services that they may need to have. And we actually set up a treatment plan customized towards that particular person, so that no one plan is the same, because everyone's life has got different demands. Mm-hmm. And having an outpatient service like this, a lot of people don't have time to go away for a month for their addiction. This gives them an opportunity to continue their life with their family, their job, and also on their way to recovery. So we feel very proud of what we're doing over at Brightview as far as having people come in, because if someone is that day they want to get service and they can't see someone, the next day they may change their mind. We feel that day they show up, we're going to welcome with open arms, give them resources that help them, not just on outpatient services for their recovery, but other areas that we can help them, case managers, group therapy, and a lot of other resources that we have as far as working with our patients.
One of the things that I wonder about is whether, I tend to think of people in need of these services and in crisis. and how easy or hard it is for them to recognize that for themselves. How often when you get somebody walking in, like we were just talking about, has that person made that decision for him or herself? And how often is it that somebody else is escorting them there? In recognition that this is what needs to happen.
You're going to see both sides of it. Obviously there's some patients coming in because they're court ordered, and when they have to do that, we're trying to help that person because they've been in and out of the court system quite a bit. So obviously they're coming in with a court order. A lot of other people come in based on just they've had enough. They want to get help and want to move forward. Other people coming in just because they've gotten out of the emergency room and they've been given a bridge script. Now they need to take the next step to helping them get recovery.
Mm-hmm. And do you find that it's just it's different to work with people depending? Let me put it this way: how important is the patient's attitude towards his or her recovery in the chances for success of that recovery? In other words, if you've got somebody kind of dragged in there either by court order or by a concerned family member or friend or something like that, is that already automatically starting with a heavier lift for you and for the patient?
Yes and no. I think what it comes down to is how we go about it. Is we're going to treat that person as a person and treat the addiction as a disease. And by doing that, we want to make them feel welcome and that we're here to support them and here to help them. They may have relapses as they go along, but we're not going to turn them away. We're going to continue to work with them. So if we show empathy and compassion to them, they don't feel like they're just pushed off to the side like sometimes society can do with this particular disease. We just got to battle through that and work with them. And that's one of the big things about what we're doing here at Brightview as far as helping people. You're going to have some people push back. But when they're ready, they know that, hey, we were there for them. And you know what? I feel very comfortable going back and trying it again because sometimes their mindset may not be right at that particular time. Maybe if they go home, maybe they think a little bit more, hey, that person was really trying to help me out. I mean, it was a little too hard on that person. You know what? I want to go back.
How do you guys have any opportunity to know what happens when somebody's course of treatment is done with you? So in other words, like you said, you're part of a network of different service providers to help, and you are yourselves trying to facilitate other services for a patient so that he or she again is not left aground with just having gone through this recovery process and then they're thrown back in without the same supports that they didn't have earlier. So how much are you able to see what happens or know what happens after a patient leaves?
Well, like I said, the treatment program for a patient is customized towards their needs and what they're dealing with. And the provider that works with the patient sets that plan. And there's a course of how we go about it. The MAT, the medication is, for addiction treatment, is a program that helps the patient wean off of their addiction. And that's an area that really helps the patient because it does prove results. 90 days does make a difference. And we've seen major results as far as reduction, as far as a lot of different things. And one of the areas that's right here is, we've seen a decrease in substance abuse, 70% by doing that. So
you mean in the patients that have come through your doors,
correct.
70% reduction in substance abuse
when they stay on the MAT program, that's a big thing. The other area is a 50% decrease in alcohol consumption, 70% decrease in time spent in jail, 50% decrease in unemployment, 60% decrease in arrests. So by working and getting on the program with the MAT and working with the provider, it's a step. There may be some relapses, you can't control that. But we're continually trying to get them and the patient to move forward. And how they go about it is a process. So as they continually get better and better and better, they're weaned off of the medication and treatment, and then all of a sudden they're able to go back. And so if a patient stops coming in, we get worried. We're gonna follow up with that patient. We're not gonna just let them go away. So and we work with our partners as far as that as well too.
Yeah, and I know that you have reminded us a couple of times for sure, so I don't want you to think that I wasn't listening. I know that each patient's course through your particular, your particular facilities is a customized course. But is there like an amount of time that you know is necessary for most people to be able to commit to coming to those sessions over a course of time in order to ensure the best chances for success? Can somebody, so in other words, do you have again, customized as it is it like a 3-week program? Is it anything from 3 weeks to, long time, or is it just really different for every single person?
It's different for everyone. Like I said, the 90 days, that's a real big part right there. The first 90 days makes a major difference. Some patients have longer periods because it depends on the addiction they have towards a particular one. It could be an opioid, which is going to take longer. There's a whole process that we go through on that. So it's just not one particular customized, 1 day a week or 3 months and you're done. It could take longer. And I think one thing is it's always there. You're always recovering from your addiction. And you always have to have that support. And then it goes into other facets of the support you have, whether it's working with group sessions, working with other people. A lot of people that are in the industry that are actually helping a lot of people with recovery are former addicts themselves, and that's so they know the language. They know what they're dealt with, and because they've been there, and that also helps the person that's trying to get recovery.
I wonder if you could share any wisdom you have about I assume that part of the treatment that people are receiving in these situations is around giving them tools to be able to go back out either after the course of treatment in general or whenever they're not in the facility and they're at home and in their lives, et cetera. Tools and supports that they can carry around with them. I wondered if that is the case, if you could give us examples of some of that kind of thing.
Are you talking like for a job specific or?
No, but more like so when the person is in your facility, I assume that they're meeting with, I don't know, therapy, well, maybe I should reframe it and just ask you, when somebody is in the course of treatment, what would a visit to the facility look like? Standard, okay, I'm going there today. What would that look like? Who are they talking to? What are they talking about?
Sure, I understand now. What it comes down to is after they do their first initial intake, going through the medical and the clinical, and they meet with the physician. The next day they come in, they set their plan. So an everyday situation of coming in, they'll be greeted at the front door by our staff at there, and then they may have to wait in the waiting room for a little bit, but then they will meet with their provider. Whether it's a therapist or a doctor, whatever is going on that particular session. They have closed doors. It's all privacy. Sometimes it could be telehealth too, because right now with the shortage of medical professionals and therapists and so forth, it's just not here in Massachusetts, it's nationwide. So we'll utilize our other providers that could be down in Hyannis or Lowell, and even though the appointment's in Arlington. So they're not going to not have an appointment. They'll always have that opportunity to see someone, whether it's face-to-face or through telehealth.
And that basically you were saying could be a therapist, it could be a physician. It just kind of depends on what is going on with that particular patient.
Correct.
What clearly what their needs are and how to address those.
Correct.
And these are outpatient treatment clinics. Does that mean that that really it might be just as a visit? It's not necessarily a daily visit that's required for any length of time or anything like that. It really just you work with every patient's individual schedules.
Correct. So they could be coming in, most of the time it's once a week, depends on how often the provider wants to see that particular patient. But again, we have 12 centers throughout the state and 80 throughout the country, and we only utilize the telehealth for the the providers here in Massachusetts. So we're lucky on that aspect. So if someone's out a particular day, but we usually have the patients always seeing the same person all the time. So there's continuity and consistency.
Yeah, I would assume that's a really important piece of things. You were talking about how there is a shortage, as I think most people are aware of, that there's a real shortage on the healthcare professional side, and that you guys then need to make use of telehealth in order to make up for that, among other things, which makes sense. But that makes me wonder, what are the challenges? That's clearly a big challenge, right? Just having enough providers. And being able to access enough providers. Any other challenges that are really glaring, or that you'd want our audience to know about in tackling this really difficult stuff?
Therapists is a big one right now. We can't find enough therapists. There's a shortage. There's a lot of people that are dealing with a lot of issues right now. For a lot of different things. It could be addiction, it could be depression, it could be a lot of different things that have happened over the X amount of years with the COVID. It's affected a lot of people, adults and young children. And the therapist is an area that is a shortage here in Massachusetts and throughout, like you said, the country. So that's probably, there could be a little bit of a wait time in some areas. Depends on the center that we have, but by and large, we're trying to see our patients right away because they need to be seen, not tomorrow, today.
And I know that Brightview itself has been in business for about 8 years now, and I'm wondering whether you see, whether that's long enough for you to get a sense of things are getting better, things are getting worse. What lies in front of us?
Well, it's not going anywhere anytime soon. It's going to be, unfortunately, it's going to be here for a long time, and we're continually educating people about the addiction, the disease. And if we treat the disease like any other disease, we can help people recover. And obviously, the opioids is the situation there is a major issue, and we help people get off the opioids. It's going to help a lot of other things too.
Okay, our time has already is coming to a conclusion. It goes very fast all the time when we're talking here. But I wanted to ask you if there's anything else that you want to make sure that that our audience understands that we haven't yet mentioned, or that we didn't cover sufficiently.
Like I said, at Brightview, we treat people as people. We treat the addiction as a disease. And we're here with open arms to help them all out. They walk in, we're going to get them seen, and we're going to help them live a better life.
Great. And, we want to remind people that Brightview is, of course, one of a number of different providers of this sort. And we've asked you here to speak to the general situation. We really appreciate you doing such.
Appreciate it, James.
I have been speaking to Will LaCouture, who is, as we mentioned before, the Director for Community Outreach for Brightview, Massachusetts, all 12 facilities. 12, right?
Correct.
And we really do appreciate Will taking the time to come and join us and educate us. We appreciate your time as well. This has been Talk of the Town. I'm James Milan. We'll see you next time.